Thank you for having me. Thank you, Chris and Vada, for a wonderful conference. It's absolutely wonderful to be here with you all, and also like to acknowledge Minister Stitt for her kind words that she shared with us this morning, and her continuous advocacy over the years that she has provided to all communities in her space. This is a wonderful theme that has been posed for this conference around policy to people. And even in considering the presentation and the way I even looked at it was around, and I conceptualized it, was from policy to even practice. Because in terms of the policy getting to people, it takes practice, and you guys in the room and organisations such as the roles that each organisation plays in communities all around our practices and how that translates to community, which is an important key part of how policy does succeed in people and the advocacy that plays. For us at Ngwalla, our practice has really been around focusing on our people, how we can be better as an organisation in this space, and how we can really challenge our thinking as an organisation for the betterment of our community. Some of the areas that we have been able to, that we think about and kind of guides a lot of our work, and myself as the leader of this organisation, is certainly around these three factors of reflecting, seeing, and walking the talk. For me, reflecting is an important part of our journey at Ngwalla, and really taking on firsthand the history of who we are, how we were even come to be as an organisation, and why we even exist as an organisation, and acknowledging that just recently we've come out of also Reconciliation Week. I took the opportunity to really talk to our staff and share to our staff that if there's ever a why for us as an organisation, and what we do, and why we're in community, and why our organisation exists, is because of the disadvantages that our community have suffered from over the years through colonisation and government policy. And so reflecting for us is really a key component of that's going to shape our future as an organisation. The seeing part of that is really looking and taking a wide scope and a wide view of how things have been working over the many years in the way we've even done business as an organisation, but also looking at our partner organisations across the state as well, and how they're even leading ways in thinking outside the box and being innovative. For us and our guiding practices, just not seeing what's the now, but also looking about what's our future and how can we start to think and see the unseen, to think about how we can be creative and be innovative in the way we do deliver our services at Ngwalla, and really thinking outside the box. And to that, it's also, we have to push policy, we have to push government, to think a bit differently in the way that we see things. And I'll get to some of that conversation into this presentation, but I think it's sometimes the best practice and community result in that forever advocacy. And there's been years and years of advocacy that we know of, and I walk in shoes of those that have advocated before me, that I continue to advocate. But we also continue to strive forward to deliver a much better service response to our community that is tailored for our community and meeting their individual needs. So that's a seeing component of what we really focus on. The walking the walk is when we are successful in any tenders or any submission, or we put ourselves out there to be this organisation to deliver drug and alcohol services, homelessness services across community. It's just not doing and putting a tag to what we say we're good at. It's actually tangibly saying that we are going to be there and do that for community. And I think we have a great example of that through our public intoxication response, where a supportive advocacy went into changing policy and legislation around the decriminalisation of public drunkenness, and how that then translated into work and practice in community, and really being there for community, in the forefront of community. So really walking that walk and talking the talk to say, if we're going to be that and do that for our community, we'll stand there and do that. So really big on those 3 points for us as an organisation, and that's a part of my reflection. a part of that reflection and kind of really understanding it, we kind of, there's some views and some experiences that we can kind of look at as an organisation, and I've spoken to some of these points around that already, but really challenging the status quo and not being stuck in just the mundane of doing things. And as you heard, I've been in this industry or across this industry for 20 years now, still young in my development. I consider myself young, so my children don't think I'm young, but that's a different story. And I've seen enough to know that I've kind of gone off and spent 11 years with Ngwalla previously, went into the child, families and youth space, and coming back into the health space, really kind of seen that there hasn't been much progression in the way we've done work for our community, and really challenging ourselves as an organisation to be better for our community in the space. And so it is one of those things that I'm pushing as an organisation, that challenging the status quo and not being stuck, and really thinking innovatively around how we do business on a day-to-day basis. And this is just a quote that I've kind of come up with myself, that the needs of our community, the needs of our people are complex and varying. So our services need to be open and ever-changing. There isn't ever one way, and we shouldn't be constantly doing things for many, many years the exact same way. If our communities and my people are struggling and their needs look different on a daily basis, well, the way I tailor and structure our organisation needs to be able to meet our community in that way. And so we come with an openness and a willingness and a way of working that we need to evolve as an organisation, as the complexities and the concerns and the drug crisis that is happening in our community is fast, rapidly changing. You know, we had in the staffing service the other day, and we had a staff member from Carinish come and present, Joe, presented to us. And just to hear a lot of some of the trends that our community are dealing with when it comes to the variants of drugs and how they're being cut and how they're being laced with different things. And so we need to be able to respond in a way that's different for our community, and with an openness to be able to make sure we have the right things in place for our community. We see that AOD continues to be a primary cause of a lot of contributing factors that our community struggle with across social and the health needs of our community. And we heard from the Val's presentation, you know, and seeing some of those stats and how AOD is really embedded across things, the overrepresentation of our community, the underlying cause of that being AOD. Some of the best work that has come out of this state and success that we see ourselves in every day is when there is good collaboration, regardless if that's internally collaborating with some of your internal teams, but also collaborating externally with partner organisations. Sometimes when we work collaboratively, well, there is some really incredible results, and we can testify to a lot of that work that we're starting to see and shift with the way that our staff engage across partner organisations. I'm mindful of time, so I'm kind of rushing through, so I don't want to get to a 1 minute slide, so I'm going to speed through. This here is a bit of a, again, you know, as we heard some of what Val spoke about and some of the trends and what's happening in the justice space and prison space, here is just some snapshots of areas that we see, you know, and we ask ourselves these questions, you know, why do we continue to see the number of our children out of home care continue to rise, and not seeing a lot of our kids return home to families? I've worked on cases where you know, it's resulted in kids being in out of home care for long periods of time, where there are family members that were more than capable to look after them, but because there was a concern, and all it was a concern of alleged alcohol and drug use, kids remain in the out of home care spaces. So challenging even those thoughts. Well, if they're not substantiated cases, why can't our kids return back to home? Why can't they be back with families? If AOD is there. Incarceration rates, again, we just heard the disparity in that. 20 years ago, 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 20 In the family violence spaces, we see that our women are suffering in the family violence spaces significantly, and these are all impacts of drug and alcohol. So if the impacts of drug and alcohol are a contributing factor across all of these areas of child protection, incarceration, family violence, mental health and homelessness, we have to start to continue to push policy, push government around well, drug and alcohol needs to be more than just lip service now. We need to see a greater investment across the state of Victoria. And particularly in the Aboriginal space, we've been doing a lot of background work around looking at the services and treatment services across the state. And for those of you that don't know Ngwalla and the work that we do, we are a drug and alcohol and homelessness organisation, also have some other services that we operate in. The drug and alcohol space for us is and challenging the department from what we understand and what we know of, and don't quote me on this, but I do believe this is going to go on YouTube, so I probably shouldn't quote something in it, but the investment of drug and alcohol for Aboriginal and Torres Strait Islander people is only at 33 million, from what I understand, in the state. And the treatment response to that is there's hardly anything. That's case management and some other services that's provided. Bunjawara in the state is probably the only Aboriginal specific treatment service that's funded in the state of Victoria for Aboriginal community. We run and operate the only 3 Aboriginal rehabilitation services in the state that isn't state funded. And so we need to see a better investment from government into this space of drug and alcohol so that we can better meet the needs of our community across the community of the state. So if we know that a key contributing cause of drug and alcohol is a concerning factor of all these areas, we need government to start to come to the party and take us seriously when we start to advocate in the space for our people. This is, for me, a great example of something that is of policy to practice or policy to people. This is our public intoxication space. We went so through a period of a trial period that the government went through of delivering a public intoxication space before the decriminalisation actually happened. We had an opportunity to come in and play a role in the southern area of Victoria and southern metropolitan area. And so a part of that response for us to deliver on a model, it took a bit of a turn where we couldn't actually deliver a residential type response or sobering up centre response. And so we went back to the department and said, okay, well, we don't just want to sit on money that you've given to us. We want to think a bit differently and a bit creatively in this space of how we want to respond to meeting our community in community. And so we developed from there the birth of our coffee vans. That's where that came out of, an initiative where we thought, well, why don't we go buy a coffee van? The coffee van is going to be in community. We've then created this team called the Community Matters team with a nurse and 2 assertive outreach staff that are in community. And so this is where our response, and you might have over the last 2 years started to see our coffee vans out in community and a lot of that happening. And so the department trusted us in that, and so we're able to build on delivering the Community Matters team. From this response then came the public intoxication model itself and the tenders, and so we submitted that in 1 metro. And the way that we deliver our services, and there's a very small picture, but I guess the background picture of this is actually our sobering up centre in Mitchell Street and what it actually looks like. Creating a safe space and a very culturally safe facility for our community. And so delivering this response was about, yes, we want a team out in community constantly, servicing all the hotspots of community, wherever they are in across Melbourne metropolitan. And I can say we had some incredible guys that just had a heart for community, that were out there and just willing to go into all the areas of Melbourne Metro, really. Firstly, just giving them a coffee, giving them a drink, giving them some rough sleeper packs, just something that was just an easy tool to engage with our community. And from that, then it went on to a further response, and that's where the public intoxication team came into it. And so they make referrals into our public intoxication team, and so we can then send out a team that then goes to community, meets with the community there, and as you can see, that's one of our nurses that was actually sitting with community members. And this has been a service that, yes, we are targeted for Aboriginal and Torres Strait Islander community, and that will always be our priority, but our services we extend to anyone that comes up to our van in community. And so for us, this is, if ever you want to have a bit more of a conversation around the public intoxication response in the team, I've got the PIR team here, and you'll probably hear from one of them through a panel as well. But anytime you want to come over to Ngwalla, have an opportunity to sit with the team, more than welcome to do that. And they're incredible. It's about, again, it's just about being in community. So here we are, we've seen policy legislation change. We've gone, okay, this is what we need to do in our thinking to be able to meet people. We create a response to be in community where we need to be visible for our people and a safe response at that. But we also need a safe space for them to come home to, or to come back to, so that we can take them back home to their place of safety, to their family. And we've had some incredible responses. So I'll leave that there. Thank you. I do have staff around if you want to have a thing. Thank you.